Hello, I'm Dr. Philip Levin. We're talking today about cannabinoids and use for seizures. Epilepsy refers to a condition where the person has recurrent seizures. Seizures are usually caused by an electrical storm in the brain, usually triggered by a single spot, after which the electrical storm flows throughout the whole surface of the brain, causing recurrent seizures. There are different types of seizures, the most commonly known as grand mal, in which the whole body convulses and the patient loses consciousness. But there are many other types, such as petit mal. The person just has an episode of staring and unawareness of all that's going around him and amnesia for that episode. There's also such things as focal seizures, where only one part of the body is involved, like just the arm will tremble or funny smells will occur. About 1/3 of patients with epilepsy have drug-resistant seizures. That is, they are not controlled with 2 anti-seizure medications at appropriate doses. Cannabinoids have been proven to be effective in reducing both the intensity and frequency of seizures. Most famously, a young girl named Charlotte had totally uncontrolled seizures several times a day until initiated on cannabinoids, which were able to successfully totally stop all of her seizures. They named a brand of cannabinoids after her called Charlotte's Web. Some types of seizures respond better to cannabinoids than other types. Focal seizures in particular respond better, and then 2 specific types, Dravet and Lennox-Gastaut syndromes, all respond best to cannabinoids. Both THC and CBD are effective in seizure lowering and control, although CBD is usually preferred because of the psychotropic effects of the THC. The prescription drug Epidiolex is all CBD, and that's what's often prescribed for helping to control seizures. Studies have had mixed results. That is, for many patients, seizures are completely controlled or greatly reduced, but for some patients there's a paradoxically increased rate of seizures. It also one has to deal with the general side effects of cannabinoids. For the THC, the mental effects, and for the CBD, somnolence and GI symptoms such as diarrhea or constipation. Like all treatments with cannabinoids, it's best to start with low doses and increase slowly. However, for seizure control, usually very high doses are needed, such as 50 milligrams per kilogram of CBD, which is a pretty high dose, as well as upper limits of THC, 20 milligrams or sometimes even more. Before starting any new medications, particularly for something as serious as seizure control, be sure and consult your physician. This has been Dr. Philip Levin with a short cannabinoid medical information.